Hemophagocytic lymphohistiocytosis, HLH, is a severe syndrome of hyperinflammation driven by massive overexpression of interferon gamma. This photomicrograph shows the pathology after which the HLH syndrome is named. The large cell is an activated macrophage engaged in hemophagocytosis. Primary HLH, one form of the disorder, is caused by mutations in genes encoding proteins involved in the cytotoxicity of T lymphocytes and natural killer cells. In healthy individuals, during defense against infections, cytotoxic CD8-positive cells recognize and bind to antigen-presenting cells, and then release perforin and granzymes into the immunological space. Perforin creates pores in the target cell's plasma membrane, allowing entry of cytotoxic granzymes causing cell lysis. Patients with primary HLH have genetic defects that result in ineffective control over infection. For example, in case of a mutation in the perforin gene, perforin deficiency prevents the perforin pore formation needed for cell lysis. Failure to kill the antigen-presenting cell leads to proliferation and hyperactivation of T cells and the massive release of pro-inflammatory cytokines, most notably interferon gamma. After release from cytotoxic T cells, interferon gamma binds to its heterodimeric receptors expressed on the cell membrane of macrophages. Receptor stimulation leads to gene transcription and activation of macrophages that release high levels of pro-inflammatory cytokines. Interferon gamma is a key upstream mediator of these pro-inflammatory cytokines. Macrophages that are activated by interferon gamma play a central role in the pathophysiology of HLH. Persistent activation of macrophages and cytotoxic T cells results in the secretion of high levels of multiple cytokines such as interleukin-1, interleukin-6, and tumor necrosis factor alpha. This cytokine storm contributes to the signs and symptoms of HLH. Hemophagocytic lymphohistiocytosis, a life-threatening hyperinflammatory syndrome, characterized by fevers, hepatosplenomegaly, severe cytopenias, hyperferritinemia, coagulation defects, liver function impairment, infections. GAMIFANT, emapalumab-lzsg, is a high-affinity monoclonal antibody that binds to soluble and receptor-bound forms of interferon gamma. It was developed specifically as a treatment for primary HLH. GAMIFANT binds to interferon gamma and neutralizes interferon gamma activity. This blocks interferon gamma-induced intracellular signaling and activation of macrophages. Blockade of interferon gamma by GAMIFANT stops macrophage activation and the downstream release of pro-inflammatory cytokines. In clinical trials, interferon gamma neutralization with GAMIFANT was shown to reduce the rapidly progressive life-threatening symptoms of primary HLH. Indication and usage. GAMIFANT, emapalumab-lzsg, is an interferon gamma-blocking antibody indicated for the treatment of adult and pediatric, newborn and older patients with primary hemophagocytic lymphohistiocytosis, HLH, with refractory, recurrent, or progressive disease or intolerance with conventional HLH therapy. Important safety information. Before initiating GAMIFANT, patients should be evaluated for infection, including latent tuberculosis, TB. Prophylaxis for TB should be administered to patients who are at risk for TB or known to have a positive purified protein derivative (PPD) test result or positive interferon gamma release assay. During GAMIFANT treatment, patients should be monitored for TB, adenovirus, Epstein-Barr virus (EBV), and cytomegalovirus (CMV) every 2 weeks and as clinically indicated. Patients should be administered prophylaxis for herpes zoster, pneumocystis jirovecii, and fungal infections prior to GAMIFANT administration. Do not administer live or live-attenuated vaccines to patients receiving GAMIFANT and for at least 4 weeks after the last dose of GAMIFANT. The safety of immunization with live vaccines during or following GAMIFANT therapy has not been studied. Infusion-related reactions, including drug eruption, pyrexia, rash, arrhythmia, and hyperhidrosis, were reported with GAMIFANT treatment in 27% of patients. In 1/3 of these patients, the infusion-related reaction occurred during the first infusion. Adverse reactions. In the pivotal trial, the most commonly reported adverse reactions, greater than or equal to 10% for GAMIFANT, included infection, 56%, hypertension, 41%, infusion-related reactions, 27%, pyrexia, 24%, hypokalemia, 15%, constipation, 15%, rash, 12%, abdominal pain, 12%, CMV infection, 12%, diarrhea, 12%, lymphocytosis, 12%, cough, 12%, irritability, 12%, tachycardia, 12%, and tachypnea, 12%. Additional selected adverse reactions, all grades, that were reported in less than 10% of patients treated with GAMIFANT included vomiting, acute kidney injury, asthenia, bradycardia, dyspnea, gastrointestinal hemorrhage, epistaxis, and peripheral edema. Please see the full prescribing information on www.gamifant.com.